So, what are some of the key things, though, that we should see with POTS? Well, if you're an adult, you should see a change in your heart rate of greater than 30 beats per minute when you go from laying or sitting to standing. Now, this should occur within 10 minutes of standing up. Now, if you're an adolescent, so 18 years or younger, we're actually looking for this to go up 40 beats per minute. Now, there are some thoughts that even having sustained heart rates greater than 120 may be criteria, but it's not universally accepted quite yet. Now, the other thing, while you should have increased heart rate, you should not have a significant drop in your blood pressure when you go from sitting, laying to a standing position. So, what does significant mean? Well, it's a change of 20 in the high number or 10 in the low number, greater than either of those. So, let's say your laying down blood pressure is 120 over 80. Well, if you drop to 96 over 80, that is considered a bigger drop than it should be. Or you could be 110, but then that bottom number drops more than it should be, right? A lot of people, it's going to be both. So those will drop. Now, if those drop, you do not meet criteria for POTS. That is something else, orthostatic intolerance, which we'll save that for another time. Next, you must have had these symptoms for at least 6 months. Maybe this will change in the future, but presently you need to have had your symptoms for at least 6 months. Okay. This cannot be something you've had for a few days or a week or two. If you get diagnosed and you've only had it that long, then that'd be an improper diagnosis. Now, lastly, when we look at anything in the world of healthcare, it's important that we realize that other causes that could create these symptoms have been ruled out. Now, you may normally the treatment for POTS for most people is compression stockings, increase your salt intake. If your heart rate's going crazy, they'll get put on a beta blocker or something else like that. Now, I get those who are not getting better. So I'm not going to spend a lot of time on the hypovolemic because a lot of those people end up at cardiology and they can do well with that. Whereas I see the people who tend to have the neurological as well as the immune system based POTS. So now we've talked about the symptoms that someone can have with POTS.